Hello, everyone. Welcome and thank you for joining us today. My name is Imaeyen Okon. My pronouns are she and her, and I'm the Project Explorer Officer at CanWatch. I would like to begin by paying respect to the Anishinabeg and Haudenosaunee people who are the traditional guardians of the land commonly known as St. Catharines, upon which I live and work. I acknowledge their long-standing relationships with this territory, and I pay respect to all indigenous peoples in this region from all nations across Turtle Island. Today, we'll be looking at data-driven results through a practical guide for using a development database to improve programs. Through this session, we'll be showing you how data can be analyzed and visualized in order to improve programming, identify gaps, and inform policy and investments in order to strengthen the health and rights of women, children, adolescents, and their communities worldwide. Now, I'm so excited to share with you the CanWatch Project Explorer, or the ProX for short. For those of you who are not familiar with the tool, the Project Explorer is an open access database that aims to capture the most comprehensive set of data on a wide range of development, humanitarian, human rights, and gender equality projects across Canada and the world. Now, this could be driven by Canadian funding or through Canadian organizations and their international local partners. Leveraging information and evidence generated directly from this sector. This database connects users with timely information and resources that are relevant to your work. Now let's take a look at what information we can glean from the Project Explorer. It contains detailed information on who's involved in the implementation and delivery of projects. This could either be civil society organizations, NGOs, or other organizations, even from the private and public sector. It tells us what areas of interest are being addressed, and details on budgets and source of funds. This could either be federal grants or from donations. It also shows us where organizations are working globally, both domestically and international. Now, to go a little bit deeper into the data that we collect, we capture 17 key data pieces that programmers care about most when measuring and communicating their work. Now, this includes target population and population numbers, outcomes of activities and results achieved, indicators measured, and so much more. The ProX is user-driven, and it allows organizations to directly control the information that they're sharing with us. In this way, it can attest to its accuracy, and we are sure that we're properly representing the work of these organizations. Now, just to give you a little bit more in-depth understanding of what you can gain from interacting and using the Project Explorer. There are several ways in which this can be a useful resource to you. For one, it offers users opportunities to identify common or prospective funders and common partners with similar interests. It also helps facilitate global to local connections. Say, for instance, you're developing a project in Tanzania and you'd like to know who the local partners are on the ground so you can collaborate with. However, this information is not readily available and isn't the easiest to get. But with the ProX, you have access to contact names, emails, and the partner organization names that you can connect directly to help. And this can serve as an opportunity to learn and work together more effectively. Now, the ProX also creates valuable partnerships through linkages to other platforms. Now, at CanWatch, we have several working groups, and the Haiti Country Working Group is one of them. And with the Haiti Country Working Group, it essentially brings together Canadian partners who are working in Haiti. So if organizations are working with the same Ministry of Health or department or in the same district, they can easily connect together and work better to strengthen their work and learn from one another. It also serves as a communication and reference guide for your presentations, for reporting purposes, and to communicate key messages. Now, it helps you map out your next project steps, map out gaps, and any community needs that you've identified as you're working through your project development stages. Now, the ProX data has been used to demonstrate impact in various ways. One example of how CanWatch has used this data is in our broader data tool, which is our Global Health Impact Report. This is essentially a compilation of Canadian contributions that shows the work that is being done in international development. It features rich case studies of projects and best practices. It also gives opportunities for advancement in global health. Now, as you can see on the screen, we have a snapshot of global health priorities that have been identified in the last decade. And this is something that we've pulled from the Global Health Impact Report. One other thing we've been able to create is what we have our country dashboards, where we take a deep dive into country level specifics, showing some in-depth analysis on the work in those countries. As you see here highlighted, we have done analysis to show top 10 areas of work in Tanzania. And as I mentioned with the partners in Haiti, we've also developed custom maps that you can easily access and get connected quickly. We've also featured Canadian leadership around the world through our social media, like with our Lead on Canada campaign, International Day promotions, and this features projects from our partners. So this could be CanWatch members or non-CanWatch members. It also, we've just featured anyone who's involved in using the Project Explorer and has projects in there. So essentially by adding your projects to the Project Explorer, you are able to showcase your organization's achievements and impact to a broad audience. Now I will be taking us through the website to look into the Project Explorer tool itself and see the features that it has. All right, so here we are. As you can see, the map features projects. All of these dots and numbers shows all the projects that are in those locations and regions. You can zoom in to see a particular country or a set of projects and find out what those projects are. Now with the Project Explorer, we have multiple search options that allows you to explore the projects and the data that we have. You can filter from one of our 29 health and development topics. You can search by region and country, you can search by organization, and you can also look at key words of interest to you. Let's take a look at reproductive health and rights, for example. Now, everything in all the data in the Project Explorer contains projects that are active and inactive. So you can either select to include all the inactive projects, or you can only look at projects that are currently ongoing. Now, if we click on Show Projects, it gives us a list of all the projects that are being carried out on reproductive health and rights. And it shows here you have the total number of those projects, and you can see in full detail and their locations as well. The regions and countries. Let's take a look at Tanzania. Here, when you search, you pulls up all of the projects that are currently being implemented in Tanzania, both ongoing and completed. You can also search again only the active projects if you would like. Now you can also go into specific organization details to see what projects they're working on. And if we pick an organization, let's say Water Aid Canada here, you can see all of the projects on which they're a lead organization. Here, now we're going to our project level data, and you can see all of the information on that project. So the budget, the timeline, you see that it's still ongoing. You can find the contact detail here to reach out to if you would like. It shows you the organizations that are participating on this project, different sectors, public sector. It also shows you multilaterals, NGOs. It also tells you how much funds, the budget allocation. You can also go further, see the different countries and also the description, target population, outputs, indicators, and all of that information is available on the page. If you go up, you can also see on the map where in particular this particular project is being implemented. And like with everything from the Project Explorer, you can export this data as well. Now, with our final search option, you can type in your keywords that you'd like to look for. So say immunization, for instance. You put that in and it pulls up all of the projects that are being implemented on immunization. And you can get that information. Also, you can export it. Now, let's look at how we can add projects to the Project Explorer. How do you share your data? Where do we go to begin that process? Now to do this, you go to the top here, Data Exchange, and go to Add My Data. And it pulls up your Create an Account login page here. Now you just need to create an account, log in, and start entering your projects directly. This process allows you to save your projects as you go. You can always save them, return, and update them. You can update already existing projects. Once your project is submitted, CanWatch will review it and then publish it for the world to see. Now, if you're not ready to create an account and you're still gathering your data, but you'd like to have it featured in Project Explorer, please reach out to us and we'll be happy to help you through the process of including your data. If you have more questions that you need answered and you want to read more, you can check out our frequently asked questions here. And it gives you a little bit more details on the process of data sharing and what data we collect. Now, earlier on, I mentioned visuals that you can get and work with. So that brings us to the analytics portal. The analytics portal allows you to visualize and aggregate the data that's provided in Project Explorer. So you can get a clearer picture of the global health and development impact by Canadians across the world. The different tabs show you different levels of information and different content. So we can begin with the global snapshot. On this tab, you can see project details and information of Canadians and their work across different regions, countries. If you go down further, you can see the individual projects and you can see their duration, and that tells you how much time and the trends in which this work has been going on. You can also go a bit further and you see the organizations that are implementing these projects, a cross section of organizations. Again, no organization is too small or too large. We have all organizations featured in the ProX. Now, if you go to our country snapshot, here we have country level data and we break down to the specifics for each country. So again, you find project duration, you can see a time period over, the types of the projects that are being implemented, the types of projects. You can again see the organization details. And here we go in also to look at the areas of focus that these projects have really worked on. We can also see the funding allocated over time to those areas. So say, over a period of time, this is how much has gone into education, how much has gone into nutrition, and we break it down in different charts and graphs that are, that are more appealing or that are useful to you. And we also have disaggregated population data. We also have our target population descriptors, as I mentioned earlier on. We have all of that information available to be downloaded. So you have access to all of the visuals as well. Finally, we look at our areas of focus tab. And here, just as you saw with the country snapshot, you can go in and look at the topic areas over a period of time. And you see where a lot of focus has been over the years, or if you're looking at a particular year or a particular topic, say again, like we did with reproductive health, and rights, you can see here the trend over time, how much work has gone into this, how much funding, and you also see if you can compare different areas and different topics, and just to give a sense of where the focus has been, where the priority has, what the priority issues have been over these years. as CanWatch asks organizations for projects all the time, and for data all the time, we are confident that what you're looking at is not stale information. You're looking at up-to-date and current information. And with that, I'd like to say thank you. Thank you for taking the time to be here today. For more information, please reach out at impact@canwatch.ca. Thank you.
Hi, my name is Shawna Novak, and I'm from the Canada International Scientific Exchange Program, otherwise known as SICEPO. And I'm delighted to be with you here today. I'm coming to you from Toronto, but I'm bringing to you stories from our friends in Israel and Palestine, and a story here from Toronto, Canada. We're going to share with you some experiences on a pandemic pivot from our nonprofit, SICEPO, and our partners in the Middle East as we responded to COVID-19 using design think, translational science, implementation science, in order to address the changing realities of COVID-19 on the ground. I'm thrilled to bring to you today Dr. Roni Dodiuk-Gad and Dr. Akram Amro, who I invite to introduce themselves. And then we're going to get into a fireside, relaxed chat where we talk about some of the experiences and delve in further to some of the interesting things that we've been doing together over the past almost a year of the COVID-19 pandemic. Dr. Roni Dodiuk-Gad, would you like to go first?
Thank you very much. It's a great honor to be here. Thank you for inviting me. So my name is Roni. I'm the vice head of the dermatology department in Emek Medical Center in Israel. And I'm also the program director of the residency program in dermatology. I work as an assistant professor, both in the Technion at the University of Toronto. And I have the honor of being the head of the International Telehealth Rounds in Dermatology, an international platform for dermatology teaching, which is under the auspices of SICEPO. And part of it is just that we launched in the beginning of the pandemic another platform that is International Dermatologists Fighting Coronavirus Together, that currently includes 700 physicians from 20 countries. Thank you very much.
Thank you so much, Roni. Dr. Akram Amro.
Okay, my name is Akram, and I am CEO of a non-profit Palestinian organization called Greenland Society for Health Development. And our main focus is environment and health. And we've been involved in COVID-19 fighting since the beginning, together with other Israeli organizations and national organizations within the consortium. We've been part of the efforts of Project Rosanna International to get ventilators into Palestinian Health Ministry hospitals to cope with the increasing need of people needing ventilators. We've been doing awareness campaigns for prevention and preventive measures of COVID, and now we are focusing on convincing more people, even though we didn't have the vaccine, but because stories about the vaccine started, we are in the process of campaigning for pro-vaccination when the vaccine is available.
Yes, it's been quite an experience on every single level in addressing things like vaccine hesitancy, in educating on protocols to reduce positivity rates all around the world, and looking at supply chain issues, looking at the education piece, which we've been able to do together on a really successful basis. It's kind of neat and exciting to see how we've been able to repurpose digital platforms and re-engineer social models to be able to influence behavioral change using things like the 5 Spice framework and Cube's toolkit for behavioral change, which we'll get into a little bit later because I really want to focus on your experiences as well. Here in Canada, we've been working together in order to respond with our local public health units and Ontario Public Health. And as a nonprofit, we've been able to jump right in doing projects together like the ITMD program and like the program with Project Rosanna and Greenland. And so one of the things that I want to ask you is, what do you think your experiences, or what have your experiences been like over the past year in being able to work with Canadian, Israeli, Palestinian, and global partners during COVID-19, as opposed to having to work independently? Because this has been a very interesting time where we've been able to create spaces that haven't necessarily existed before for this type of cooperation. Akram, would you like to go first?
Maybe as an organization, most of our work that we do is cross-border cooperation, which means we do all our projects with Israeli organizations from values that we believe in, that this could contribute to a better future of the two nations. And at the same time, it's a very complex area here in a way that it is very much interactive, in terms of how many Palestinians leave every day to Israel and how many Israelis from Arab communities come to shopping in West Bank. It's a one community from different entities, I would say, which shows you at the end, environmental-wise, we live in the same place, and then we've found ourselves in a position of most of the time having really recognizing how much important is to work to each other. And we have been successful to work with different Israeli organizations. We've been partnership with Magen David Adom and with Zaka organizations in creation of local emergency response teams. We've been a partnership with Khairiyya Ariel Sharon Park in Tel Aviv in building an educational environmental center. We've been partnering with Mashav, Minister of Foreign Affairs, in upgrading professionals of allied health professions with more than 18 courses, 1 week plus minus length of course, in upgrading their scientific and professional background. We've been partnering with the Machon Negev Ajik on the issue of electronic waste burning and e-waste coming from Israel. And now we are in the process of creation of a rehabilitation hospital that we want to build together with the Israeli organization of Beit Levenstein, which is out of it's a top standard rehabilitation level that we could speak on the level of the Middle East. Every year that passes, we recognize how much we were through in those kind of projects that makes us not just on the level of dialogue like peer-to-peer or people to people, but it's on the level of development together. It's developing together, progressing together, learning together, and we are very proud that some of our partnerships was with the Ben Gurion University, where we tested really very modern technologies in rehabilitation, which was one of its first in the world, and we published those articles together as Palestinian and Israeli scientists. And with the current situation of COVID, it pushes us more towards searching for more partnerships and more cooperation, together with the international support and international assistance in different ways, whether it's capacity building or even the financial support in trying to improve the quality of life of people, both sides, through education and through even health services provision on the field. Maybe we touch it more here in the Palestinian community, but also in the Israeli side, there are some communities, some Arab Bedouin non-recognized communities, where we share lots of the challenges, and I think we should continue in searching for international umbrellas for Palestinian-Israeli cooperation on projects that really can create better circumstances and better quality of life for people on the ground.
Well, that's been quite the experience for you. But I'm glad to hear that the international umbrella model has been effective in facilitating some of this. It's been really interesting, following and supporting your work on a regular basis, and seeing how you were able to adapt and independently initiate well-informed programs on the ground that were in touch with the needs of each of the different communities, not just around Hebron where you're based, but in Palestine as a whole.
West Bank, in Gaza.
That's right. Yeah. And that's not just during the pandemic, that's been prior to the pandemic, but expanded somewhat, right?
Yeah.
Yeah.
During the pandemic, there's more legitimate reasons and more really stronger reasons why people should talk to each other and work together, because as I'm telling you, we're sending 300,000 people and distributing them in all Israel like on a daily basis. And you can't really look at Israel as one entity where some tourists come with the visas. It's not this way. So we are talking about the same environment and a continuous daily interaction on different levels that makes it difficult for Israel even to plan on a health level when it comes to a pandemic and an infectious disease, neglecting West Bank. And I think the Israelis are more interested now that the vaccine comes to the West Bank more than I think some Palestinian entities, because it is their core interest to make sure that what happens in Israel is happening in the West Bank, because at the end, it's a very small geographical area.
And do you think that this is being appropriately addressed in terms of cultural sensitivities for Palestinians?
So, it's something that is important to know, that health and economy could be really the most acceptable fields of people-to-people component and interaction. Because when you speak about health or economy, you're speaking about well-being of the people, whether here or there. And as much as the people are more pessimistic and not optimistic about whatever negotiations and peace process, if there is any, the more they are towards finding solutions on the ground to economy, health, environmental challenges on the ground. And if people are tired of waiting for a final agreement to be signed, and then based on this agreement, those areas could improve. We think we should be the pioneers, and we should, as NGOs and people-to-people organizations, grassroots organizations, to start working each in his own interest. If it was agriculture, economy, cultural, whatsoever. And then I think this is where practicing peace start, not talking about it. What else do we want from peace more than kind of normal cooperation towards the progression and development? We are not of the people celebrating 5 Israelis sitting with 5 Palestinians, talking in dialogue, talking that as if Middle East was Switzerland or the Vatican. We appreciate and recognize the challenges. We know the difficulties. We know that reality is hard, but on this basis, we build our cooperation toward goals that we can achieve. And we believe from inside that even if it was tiny contribution, but at the time, the more of those initiatives that they are augmented and they are invested in, the more that there is a better potential of peaceful coexistence that based on mutual development rather than on passive agreement of the reality.
Yeah, that's a big piece of it is the solidarity and lack of containment nihilism. So lack of buying into the concept that nothing can be done because it's not touchable. That here we are as those clinicians working in the nonprofit sector, believing that something can be done. But in order to do that it needs to be needs focused, it needs to be informed by communities, it needs to be driven by communities, and it has to have the support of good trustworthy partners that function based on mutual respect. Roni, I'd love to hear a little bit about your involvement and engagement in ITMD and the international coordination piece and the cross-border piece. You also did some really neat work in supporting and assisting one of our Palestinian residents in acquiring her resident or putting together her applications, and that came out of the ITMD program. Could you tell us a little bit about that component, the cooperation and the engagement that you've experienced over the past year or so?
Yes, sure. First of all, I would like to thank Akram for, this sharing his, thoughts and ideas, which I can fully relate. And, I would like to start with a quote, because I think it really, brings my vision of, the last year. So Professor Yuval Noah Harari said that the best defense humans have against the virus is not isolation, but it is information. And I think that was the vision of, when we started to work together, you and I, on, thinking of how can we, share information. Because I think the main thing that differentiate between us and the virus is the virus in South Africa, in Israel, in Canada, they cannot speak to each other, but we as people can. And I think that the pandemic is a great opportunity for as Akram said, for stronger international cooperation. And I think we understand that this is humanity and we are one community. And no one is, if you're not taking care of all the community, you're not going to be safe. As Akram said, we work as a community. And the community is a worldwide community. Globally, even if somebody is sick in Canada, it actually will affect us here in Israel. So we need to take care of each other, and we need to think about it in a global way, in how we do and how we work together. And I think that's the only way we can actually achieve, victory in where we're standing right now. And that was the vision of establishing international dermatologists fighting coronavirus together. Because we felt that if we share information with our friends and colleagues worldwide, then we can build stronger abilities to work on a daily basis in the hospital, learn what we need to have, what we have to do. And thanks to you, Shawna, and Saisipo, we were able actually to create it. And with the platform that you gave us, we were able to create. We had 2 international meetings. We brought people from China and people from Italy to share with us during the pandemic what they know already that we don't know yet because they had it a bit before. And they gave us really, practical implication, practical advices, like what do you need to do? How can you, make the situation better in your country? And that was so, people loved it. In 2 days, we had 700 physicians joining us. And, we opened it in a WhatsApp group. Then we had a Telegram group. Then we, it was even people say, come on, go on the Instagram. And now we have this, 3 platforms. And, we are actually, thanks to your support, we are building the new program of ITRD, of International Dermatologists, of International Talents around in dermatology, that will be launched this February, this month, on ITRD, on COVID-19 and the skin. And we have people from Canada, from USA, from Israel, from Italy, that will share information. So I think, thanks to your, you approached me before, and we were working on global cooperation even before the pandemic. But I think the pandemic just showed how important is what you're doing. And the cooperation, I think that was just very clear. And I think what was also important is the knowledge. It's free international knowledge transfer. This is our power. In 2021, knowledge is the power of humanity. We understand it now. If we know how to protect ourselves, think what the knowledge gave us. We were able to, to put the DNA of the virus in less than, I don't know, it took like 2 months, I think, maybe. I don't want to be not accurate, but it took less than half a year to get the DNA of the virus, then to get the vaccine ready, and then even to be vaccinated. It's only about the information and the importance of research and science and medicine. Mm-hmm. Work together, then you can do it. So I think that more than ever, international cooperation is, is the way, is the solution, is the right thing to do right now. And life has changed, and it will change for all of us for the next years to come. Because we understand now that it is all of us together in the same, in the same problem, and we need to cooperate. So I am very honored and happy to be part of SAISUPO. And I think now more than ever, we have many things that we need to do. And I think now more than ever, people would reach out and people want to cooperate. Because it's not us that understand that. People worldwide understand that. And I think they want to cooperate, they want to collaborate. And I think there are many options and many opportunities. The word crisis in Chinese means, it's an opportunity.
Yes.
Whenever you have a crisis, you always have opportunity. And I think telemedicine, incorporating, technologies is now also, but we can talk about it later.
Yeah. No, actually, that's a good segue to the idea of democratizing access to knowledge through technology and through models in order to turn that crisis into an opportunity on a pragmatic basis. So not just to use that as a symbolic idea, but to actually put it into practice, which makes all the difference. The translation from theory to practice, the implementation piece, the translational piece, and the engagement piece all wrapped up together. And so talking about digital platforms and different models, has this been something that perhaps has made you feel less isolated during this period of time? Can you think of an example in your own experience, whether it's within your hospital setting or clinic setting, or whether it's within the ITMD setting on a digital basis, where you've referred back to that ITMD platform in order to feel that sense of connectiveness, or built on some existing project or research plan that you had in order to change realities within Israel or also outside of Israel? I'll give you an example. We're now looking at all the different variants that are coming in from Brazil and from the UK. And there was a recent article in the Atlantic magazine about how we have an impetus as part of the international community to respond and support all of our all countries and those who are disadvantaged and don't necessarily have access to vaccines and the ability to do basic protocols like contact tracing, follow-up, or hand washing because of barriers like lack of access to clean water or crowded spaces, and how it's on us as in more developed areas or having more resources to share those resources. How have you found, actually I'm going to ask Akram first and then we'll come back to you, Roni, if you don't mind. How have you found that access to those digital tools has made a difference in and having that connectivity of resource sharing between higher resource areas to lower resource areas has improved your ability to do your work and your life as well?
Yeah, it's a platform where you feel that you are backed up with the people that knows more and had the chance to use the higher resources from their hospitals, organizations, institutions, and finally you find yourself a partner and enjoying the access to knowledge, access to skill, and with days passing, we learn more that we have to be part of such a digital backup all the time. I'm also looking at the Israeli system, like how was the follow-up for patients, even at homes and even from their home, and the mentality of the doctor being at his office serving different people in different areas and villages, and the shared knowledge, the shared experiences. It's something that strengthened us and helped us to help more people, and helps us to be up to date even ourselves if we are talking about medical stuff or even allied health professional stuff, because till now we're still learning about COVID, the different mutations, the differences, and this information is not coming from Ramallah or coming from Hebron. It comes from the world, and we need that type of authentic sources that you can update our stuff with up-to-date information and skills using those digital platforms, And mentioning that our proposed project of community health and community health mobilization training for the sake of better health for women in rural areas is going to depend very much on digital platforms and digital backup in following up screening and assessment of women in rural areas, less served rural areas in Palestinian communities, in order to help in further education and prevention of disease, whether it was communicable diseases or on the level of breast cancer and other women health related issues.
Very, very, very much so. And I think that the one area that really interests me is that here in Canada, we've benefited so much from your expertise, Akram, that you've been able to share with us and our other Palestinian colleagues and our Israeli colleagues in the multilateral knowledge transfer that happens. So not just what we're able to share from Canada, whether it's ventilation training curriculum or women's health curriculum or dermatology, but also the differences in approaches to practice and your unique approaches to dealing with diverse populations in different languages has been incredibly valuable. So in that sense, it's very much a fulsome cooperation triangular model, and you've emphasized that you've been able to benefit from the cross-border engagement, but it hasn't been mentioned, and I think it's important to mention that the benefit has been on so many levels for us as well here in Canada and also in other countries within the SISPO network. Roni, can you tell us a little bit about that as well?
Yes, you and I, Shawna, we had many conversations about our shared passion of incorporating innovative technologies in medicine, and how we think this is it's the future of medicine, not because of the pandemic, because technology is such a great tool. And it's just, this is happening with AI and teledermatology and, big data and all of that. But I think COVID-19, again, was a great, force to incorporate. People are now open to that. People think about them in COVID-19 departments, in Corona departments. So they are being treated with teledermatology, with telemedicine, and for sure teledermatology. So I think this is really, the health community, in the leadership of the health community are now more open to that. On a personal level, I find it, now that we have this platform of international dermatologists, we share cases. So if I have a case and I'm not sure about it, I'm just putting the information, of course, non-identified, nothing that could, we make sure to depersonalize, you're not making anything that could identify the person. But I'm sending the information, I'm sending the pictures. And then I have my friends from Italy and China and Japan and Canada and, even Egypt, just looking at that, say, well, I just had this kind of patient 2 days ago. Let me tell you what I've done. And it's happening, and it's like a miracle. We have people from India, she just wrote something on the WhatsApp group, 2 days ago, and we helped her, all of us together, people from different parts of the world, just to, think, what does the patient have and what do we need to do? So it's like Akram said, we feel like we have a backup, like you have a backup of the medical community, and it's like you're all together. And to be honest, I think, especially in the pandemic, that you feel so lonely in many times, because physically you're lonely. I feel more than ever being, surrounded with this power of community. And I think, again, SISPO gave me the ability to reach out to people. Because, once you reach out and you're just a person of yourself, even if you have the great, you want to do good things and you come, but people don't know you, it's like, it's hard to establish something that is so strong. But when you have such a great, organization standing behind you, people can recognize that, say, okay, well, we would like to cooperate with you. You understand that you are bringing the right values, that you don't have a hidden agenda. So I think Thysopol gave me, and I think all of us, a lot of power to go ahead and build these platforms.
Thanks, Roni. I think that that what bears mention is that this triangular cooperation model, which is very needs focused and specific, and a way for us to illustrate and to practically implement international solidarity, is also not just about the Canada, Israel, and Palestine. It's also about the engagement under the Canadian umbrella with other countries like Kenya, Algeria, Sudan, China, so on, Afghanistan, so on and so forth. And so you're not limited in any way, although it is a triangular cooperation model. It's expansive. Yes, and on that note, yeah. And on that note, we are a little bit limited to time, so I'd love to continue this conversation, maybe offline, and to thank you both for joining me and sharing your background and your experiences and your opinions. And I very much look forward to much more fruitful cooperation over the coming months and coming years. And thank you so much for everything.
Thank you very much. Thank you, Akram, and thank you, Shawna. Thank you very much.
Roni. Thank you. Okay.
Hi everyone, I'm Jana and I'm a nutritionist and epidemiologist at Action Against Hunger, where we're harnessing the power of data to trigger action. Today I'm going to tell you about Smart Plus, a life-saving innovation that provides the first ever real-time view of malnutrition on the ground, allowing us to respond faster and more effectively to hunger crises and support public health initiatives and vulnerable populations. In September 2019, I traveled to Salahad, a remote region of eastern Ethiopia where a growing hunger crisis had left hundreds of children in a state of acute malnutrition. I was there to conduct a SMART survey. For those who haven't heard of SMART surveys before, SMART is the gold standard nutrition survey methodology led by Action Against Hunger and used by aid organizations and governments around the world to identify malnutrition at population level. SMART is an interagency initiative developed to harmonize methods for nutrition assessments in emergency and development contexts. SMART provides standardized nutrition and mortality assessments to determine how, when, and where nutrition interventions are needed around the world. Action Against Hunger has hosted the SMART initiative for nearly 20 years, providing leadership on the development and implementation of the methodology to thousands of health workers around the globe.
We have selected this household randomly using simple random sampling, and now the team is taking measurements of weight, height, MUAC, and edema to check on the malnutrition status of the children. So the team is taking MUAC now.
In Salahad, my team visited over 500 households, measuring the height and weight of children under 5 to determine their nutrition status. This measurement, along with the mortality rate of the population, are the two key metrics of the SMART methodology that allows us to identify malnutrition and understand the severity and magnitude of a public health crisis. Our results showed that the children of Salahad are facing a nutrition emergency. And yet, more than a year later, they're still waiting for optimal life-saving assistance.
The SMART methodology gives us the ability to accurately identify malnutrition, but our current survey methods present many challenges. The manual data collection and input process is time and resource intensive. It takes a long time for data from the field to reach decision makers, so resources can be allocated appropriately. And while the data is passing through each of these steps, people continue to suffer from hunger and malnutrition. Here's Hailu with more information about the process.
Hi, my name is Hailu Wondim. I'm Senior Project Manager with Action Against Hunger Canada. Today I would like to talk to you about the steps we take in conducting a SMART survey. The first step is to train enumerators for 4 to 5 days on anthropometric tools, data collection tools, and formats. This involves field testing and also a standardization test to check the accuracy and precision of enumerators. Once this process is completed and the team is ready for data collection, they will go to house to collect anthropometric information using height boards, weighing scales, and MOAC. This information then will be entered into ANA software using computer by an experienced data encoder. The survey manager needs to check this data every day to check for consistency and give feedback to enumerators on a daily basis. Once the data collection is completed, then the survey manager again needs to check the whole data for its consistency plus plausibility of the data to be used for decision making. So a report will be written, a preliminary report will be written within a week's time and submitted to Nutrition Information Working Group for validations. As you can see, all these steps involve a lot of resource and a lot of time for enumerators and also survey managers. It takes a lot of energy, especially for the survey managers who are working in the field, to make sure that this data is of good quality for decision making. If the data is not collected properly, then it would mean that it doesn't give us the correct picture of the area that we want to survey.
Collecting anthropometric data is difficult and can be distressing for children and their parents. To collect this data, the SMART survey team measures the child's height and weight using a measuring board and weigh scale, and their upper arm circumference using a color-coded armband known as a MOAC band.
One of the big challenge I have personally witnessed in the field is when you have to have like 10 children. They have to be measured several times in the standardization test. Those children most of the time get tired, get fatigued, and at times I have witnessed mothers withdrawing their kids from the standardization test process. And you see, when these children get fatigued, they actually affect the accuracy and precision of the data that we normally collect. So that is one of the main challenges.
Despite these challenges, the SMART methodology is invaluable for identifying malnutrition and ensuring communities around the world receive the urgent humanitarian aid they need to respond to hunger crises. That's why we're creating a solution to take SMART to the next level and make data actionable immediately. SMART Plus is an all-in-one digital infrastructure that will revolutionize the way nutrition data is collected, analyzed, and shared. SMART Plus builds on the foundation of the SMART methodology, bringing it to the digital realm to enable a faster, more targeted humanitarian response.
SMART Plus is a cutting-edge digital infrastructure that will streamline the nutrition survey process from start to finish. SMART Plus encompasses 4 parts: the mobile app, the platform, the aggregator, and the dashboard. The mobile app is where the nutrition data is collected. Rather than filling out extensive paperwork, survey teams can record children's height, weight, and additional health indicators with a few clicks on a mobile device directly from the field. The app integrates 3D body scanning technology using augmented reality and artificial intelligence to instantly provide accurate digital body measurements for fast and reliable diagnosis. This eliminates the need for cumbersome equipment such as measuring boards. We're working with leaders in artificial intelligence like AutoAnthro from BST and the Child Growth Monitor from WHH. The platform is a central survey management tool for survey coordinators. From here, coordinators can plan, monitor, and administer surveys and share the results. The data collected in the field via the mobile app is automatically uploaded to the platform, so survey coordinators can continuously supervise their teams and track results in real time. They can also review the data and identify any problems as they arise while the surveys are being conducted. The aggregator is a central web-based repository that stores global smart survey data. The aggregator pulls together different data sets so results can be displayed by geographical area on the dashboard. The dashboard is a public interface that will allow stakeholders like governments and NGOs to work together and deliver a targeted, timely response when a hunger crisis occurs. The dashboard provides a live visualization of global smart survey results that can be viewed down to the sub-national level. The dashboard will provide a clear picture of the nutrition situation and improve the decision-making process in a given context, so funding can be properly allocated and prioritized, and policies and programs can be designed accordingly.
We think that the Smart Plus with this dashboard will really be a very helpful tool, especially for different coordination body like Ministry of Health, nutrition working groups, nutrition cluster, and other donors and policymakers at country level or at the regional level. So the Smart Plus dashboard will allow us a wider dissemination of data in a timely manner, and which will help tailored humanitarian response. Building on the experience of existing national level dashboard, this automatically updated Smart Plus dashboard will simplify accessibility and data analysis to support policy and program staff to understand the nutrition situation and program needs in specific context.
By streamlining today's fragmented and time-consuming survey methods, Smart Plus will enable a targeted response to humanitarian crises 60% faster, while saving an estimated 40% in costs. With Smart Plus, we'll be able to reach children like those in Salahat faster than ever and before it's too late.
Every 11 seconds, a child dies of hunger. I've witnessed countless tragedies like the one in Salahat over many years working in the humanitarian sector. Communities that are displaced because of drought, natural disaster, or conflict, and they're all suffering from chronic food insecurity. Regardless of the cause, these tragedies have something in common. They need a fast and speedy and effective response and delivery of vital resources so they can get back on their feet. Smart surveys are critical for that reason, because they provide the data that's needed for decision makers to be able to respond in these settings. They give us a location of where the challenge is. We know what type of malnutrition is there that we need to treat, and they allow us to identify malnourished children so that we can get them the life-saving support that they need. Since 1979, Action Against Hunger has been at the forefront of nutrition technology innovation. We created Plumpy Nut, the ready-to-use therapeutic food that we use to treat children with acute malnutrition. Another example is from West Africa, where we're connecting herders and their livestock to food and water resources using artificial intelligence. Now, with Smart Plus, Action Against Hunger is leveraging real-time data collection and tracking mechanisms to address one of the most urgent problems that our global community faces. Smart Plus has incredible potential to move us forward towards our collective goal of finally realizing a world free from hunger. It's going to allow the humanitarian community to deliver vital humanitarian assistance more effectively and efficiently. And it's going to connect the humanitarian community and public health stakeholders to better data so that we can address hunger on a scale like we've never done before.
We invite you to fight against hunger by joining our funding partners to help make Smart Plus a reality for all. Go to our website, smartmethodology.org, to learn more. Take action against hunger.